Assalamu alaikum. Hello there, my dear students. Today I'm going to talk about and show you how to examine the nose in ENT. Well, not only the nose, later on we'll talk about the ears and the throat and the neck as well. So let's just start, shall we? Now, to start with, in ENT examination, we need a table along with instruments and a headlight to examine the patient properly, and we need a stool which could revolve so that we could adjust the patient's height up or down and bring the patient to your eye level. Then this is very important, to bring the patient to the eye level so that one can examine the patient properly. And the patient's distance from the doctor should be at least an arm's length. They say, I would say a 4 arm's length, so that one can instrument the patient as well. Use the instruments or manipulate things in the nose or throat or ears. Now, we've got a patient here to show you how to examine the nose, first of all. Now, to start with, I would tell you about the headlight. Usually, ENT examination is carried out with a headlight. Now, ENT examination can be done without a light because the orifices are so small and the spaces inside are tiny that one needs a very good light in order to examine properly. So let's just start, shall we? Here is the headlight, and I put it on my forehead so that this mid part is sitting in the middle of the forehead, and I connect it with the wire so that it lights up like so. Okay, please. Now here's our patient. First of all, one has to take a consent in order to examine the patient. मैं आपका मुआयना कर सकता हूँ?
Yes.
Right? So this is how you take a consent. And now, how to sit, first of all. Now, people describe different ways of sitting. I would prefer to sit at the same level with the patient. Usually revolving chairs or stools do better, but I don't have a revolving chair at the moment, so I'm just doing it with this one. Now, first of all, the level must be the same. The patient's level must be at your own eye level so that you can examine properly. Second thing, your light must be very good so that you can place the light inside the nasal cavities or throat or ears, whatever the examination may be. Now, first of all, the patient should be so close that you could use the instruments properly. This is very important. Now, this patient is a little far, so just please a little more closer. Okay. Now, nose examination is usually, first of all, it's inspection. We inspect the nose for any deformities. And deformities in the form of a hump or a crooked nose or a deviated nasal part or a short nose or a saddle nose or any other deformities like bleeding nose or discharging nose and so on. So I just shine my light on the nose itself and the adjacent sinus areas in order to look for any abnormalities. And I don't see any abnormalities as far as the nose is concerned or the sinuses are concerned. Alright? Now, the second part is, having inspected the nose and the sinuses, is palpation. Palpation tells us about any swellings, tenderness, heat, or due to infection or other problems. Now, how do we palpate the nose? It's by using your index finger. One can run the finger from upwards to down like that on the bridge of the nose up to the tip, so that one could feel any abnormalities underneath the finger, and that those abnormalities in the form of a saddle or tenderness or a crack or a step deformity, right? So there is none. Other method of palpating the nose is running your thumb along the bridge of the nose downwards up to the tip. Okay, that's one, palpating the bridge of the nose. Next is the sides of the nose, the nasal bones themselves. This is the second thing one palpates, and that is just to elicit any tenderness as well as any deformities or break in the bones. Now, that is done by just fixing the head like that, putting one thumb on the one side of the nose and putting the other thumb on the other side of the nose and fixing the head, trying to move the nose from side to side. If the nose is broken, then usually there is a crepitus, which is called crepitus, due to fracture of the nose or nasal bones. A cracking sound is heard, that is, or felt, and that is called a crepitus. Now, moving from side to side. Other method of checking for any deformities due to breaking of the nose or fracture is to hold the nose with the index finger and the thumb and fix the head with the other hand like that and try to move the nose from side to side like that. That tells us about any mobility of the nasal bones or nasal fragments. Now, that's one thing. Second is checking or palpating the sinuses. First of all, it's the frontal sinuses in these areas above the eyebrows which we palpate. And the best method to palpate the frontal sinus is put your both thumbs, one on either side, and ask the patient to exert pressure forwards. In that way, one gets equal pressure on both sinuses, and if there is any tenderness in the frontal sinus, one could elicit it. Right? Putting direct pressure on one sinus and the other could be unequal, so that is not a proper method to test for tenderness. Second is, these are the maxillary sinus areas here, okay? And maxillary sinus is palpated by placing both thumbs, one on each maxillary sinus, one on the right maxillary sinus, the other on the left maxillary sinus. And placing these thumbs, we again ask the patient to come or try to come forward. In that way, that he exerts equal pressure on both thumbs, and we can check for any tenderness in the maxillary sinuses. Please come forward. Gill. Okay, so that's the way to check for maxillary sinus tenderness. How do we check for ethmoidal sinuses? Now, ethmoidal sinuses are usually hidden in the medial wall of the orbit. So one cannot put direct pressure in that area, but one can at least try by putting the index finger pulp at this medial canthus area and try to push inwards and medially. Sometimes tenderness in the ethmoid sinus is elicited in that way. Now, one cannot palpate the sphenoid sinus. That is one thing. Now, having palpated the nose for any tenderness or abnormalities, one goes for checking the airway, whether the nose is open or closed, whether there is partial or complete obstruction, whether there is unilateral or bilateral obstruction in the nasal cavity. And that we can do by 3 methods. One is by placing the thumb underneath the nostril, closing it off, asking the patient to breathe in. Saans andar le. Then we place the other thumb underneath the other nostril and check. That way, each nostril at the same time we can do by one thumb and the other nostril with the other thumb. Now, this is one way of checking for nasal airway patency. Other method is take a wisp, a fine wisp of cotton wool, like so, and then place it under the nostril and close off the other nostril and ask the patient to breathe in. You see the flicker of the wisp of cotton up and down. This flickering shows that the nasal airway entry is all right. So this is the second method. And third method to check for nasal airway patency is by this metallic tongue depressor, because the expired air is warm as well as moist. Placing this shiny metallic tongue depressor under the nostrils, expired and exhaled air makes foggy mist on the surface of the tongue depressor, which shows that the nasal airway is patent. Well, if you get closer, you can see the fog. Right? Now, these are 3 methods of checking for nasal airway patency. Next thing is to instrument. The first part of the nasal examination is inspection, second is palpation, and third is instrumentation. So we come to the instrumentation part, and the most important instrument that we use in the examination of the nose is a 30-Cumm's nasal speculum. This instrument is called 30-Cumm's nasal speculum, and this instrument, we have got a proper method of holding it. If one holds it incorrectly, then is bound to fail the exams. So this is very important. Then when one learns how to hold 30-Cumm's nasal speculum properly, and that the proper method is, I tell you 2 ways. One, place the tongue depressor so that the blades, these are the blades, are facing up, right? Then bring your left index finger and thumb and hold the tongue depressor with this mid part, right? First, place the tongue depressor so that the blades facing up, and it's placed on the right palm of my hand. Then I bring the left hand to hold it. And how to hold it? You hold it with the left index finger, left thumb, like so. Once I've held it like that, then the only thing to do is to bring this middle finger across this tongue depressor, across it, So once I hold it with the index finger and thumb, I bring the left middle finger across it like so. And this middle finger and the ring finger, these two fingers are acting to open and close this nasal speculum. You see the blades of the nasal speculum as being opened and being closed, like so. While the index finger and the thumb is steadying the tongue, this nasal speculum itself. You steady it with the index finger and thumb, and you open and close it by means of the middle finger and the ring finger. So that's the proper method how to hold it. Now how to insert it? We have to insert the blades of this tongue depressor inside the nasal cavity in order to open up so that we could see not only the nasal cavity, roof, floor, lateral wall, but medial wall as well. So all around the nasal cavity, there are two nasal cavities. So we insert the blades closed inside one nasal cavity at a time and open up so much so that it doesn't hurt the patient. All right? It shouldn't hurt the patient at all. And you open it as much as it will allow you to open. It's not that we open it inadvertently so much that the patient gets some pain or hits the roof. Okay? So it's controlled opening of the nasal speculum that we usually practice. And that is, now I show you how to do it. This nasal speculum I insert it in the right nasal cavity. I close the blades, then I bring it in the closed blade fashion in the nostrils and open up as much as the patient would allow me without hurting him. Can you see it? Can you show it? Okay, like so. Can you show it? Just turn your heads towards the light and towards the camera. I show you. Okay? Can you show it? Can you? A vague idea? All right. Could you get it from a distance? All right. So that's the way. Now in that position, when the tongue, this nasal speculum is inside, one can do instrumentation with the right hand. That's the way to hold it. And why we hold it in the left hand? Because our right hand is reserved for manipulations or removing a foreign body, for example, with the right hand, or probing the patient with the right hand. So left is used that way. Now that is all about nasal examination. Later on we'll talk about nasopharyngeal examination, ear examination, throat examination, and neck examination, hopefully, inshallah. Thank you very much.